Now your surgery is over. You're in the recovery room. That's called the PACU, the Post-Anesthesia Care Unit. Here's where the recovery room nurse and the anesthesiologist are going to monitor you for about 45 minutes to an hour. You're on a monitor so they can look at your heart rate, your blood pressure, and your oxygenation. We want you to be able to talk to them, tell them if you're having any pain, telling them if you're sitting uncomfortably, whatever the case may be. Here also, they may be putting squeezing devices on your legs to help prevent blood clots. They also may be putting on stockings on your legs to help prevent blood clots. These are things that they do. You're not doing anything else in the recovery room, but just recovering. If there's any issues, the anesthesiologist may come, talk to you, see what's going on, may give you medication or not. But here, we're pretty much in cruise control. You're just being monitored until you're ready to go to your room. From here, you'll go to the orthopedic unit. At each one of my hospitals, it's a different floor, but everything is still the same. It's an orthopedic unit with a nurse and an orthopedic team taking care of you. That orthopedic team consists of physical therapists, occupational therapists, patient care techs, nurses obviously, a social worker, and a case manager. Everybody is going to be working to help you start in your early recovery part, as well as what's going to be done for you after surgery. They're also going to monitor you. They're going to address your pain needs. They're going to give you your blood thinner. They're going to give you your regular medications. They're going to help you up, walk you through the hallways. They're going to help you work on getting dressed and how to address things like putting on your shoes and socks, as well as giving you different devices to help you do those things. There are devices to grasp. There's devices to help lift your leg. So each member is going to do something differently. They will introduce themselves. They'll tell you who they are. They'll tell you what department they're with, and so on. Now, you also may meet a medical doctor who's taking care of you during the hospital stay. That doctor is called a hospitalist or an internist. They're monitoring your blood pressure and making any adjustments that they have to, holding any medications, adding medications based on how you are recovering. These are very important doctors, so we want you to welcome them just as much as you've welcomed us, because they're there to take care of you, just as every other team member. Throughout the whole process, feel free to ask for anybody, ask any questions. Don't feel like we're putting you in a room and that's it. Be very open with everybody. If it hurts, let a nurse know so she can give you a pain medication. If you can't do something, let the therapist know so that they can change it or give you a break. Please be open and honest with everybody because they're here to help you and get you ready to go home.